Can dental fillings be replaced? Fillings for dental cavities are a typical procedure used in dentistry to fix dental cavities as well as restore functionality and appearance of the teeth. However, over time the dental fillings might need replacement due to damage, wear, and other reasons. In this short video, we'll explore the causes for that dental fillings might require replacement and the process of replacement involves. Reasons for replacing dental fillings. There are a variety of reasons the dental filling might need to be changed. The most frequent causes is because the filling is damaged or worn out in the course of time. It can be the result of grinding, chewing, or clenching your teeth. This can place pressure on the filling and result in it becoming weaker or even break. A third reason that is commonly used to replace fillings for dental cavities is decay. When decay begins to develop on or beneath the filling, it could require removal and replaced in order to avoid any further harm on the teeth. If a filling gets unsteady or breaks the tooth, it must be replaced in order to improve the shape of the tooth and its functionality. The kind of material that is used to fill the void can affect its durability. As an example, fillings made of metal like amalgam are extremely durable and will endure for a long time. But they might require replacement if they wear out or leak. Composite fillings, on the contrary, are susceptible to staining and chipping and could require replacement sooner than fillings made of metal. The replacement process. If you think that the dental filling require replacement, it is crucial to make appointments with your dentist as quickly as you can. In the course of your appointment, the dentist will inspect the filling as well as the surrounding tooth to assess the severity of decay or damage. If you are able to determine that the filling should replace, the initial procedure is to take off the filling. It is usually done with the dental drill in order to take off the filling while not causing damage to the tooth structure. After the filling material is removed and the tooth is cleaned and ready for the replacement filling, the next thing to do is select a suitable replacement filling material. The dentist might suggest a particular type of filling depending on the dimensions and position of the tooth, and also your individual preference. The most commonly used filling material is composite resin, amalgam, gold, and porcelain. After the filling material is selected and placed in the tooth cavity, and then designed to fit the natural shape of your tooth, the material will be strengthened by a specific chemical or light process to create a durable and solid bond to the tooth. Once the filling is put in, your dentist will ensure that the dental bite is healthy and the filling is blending perfectly with your other teeth. There may be some discomfort or pain immediately following the procedure, however, it should ease in a matter of days. Maintaining fillings. In order to prolong the life of your dental fillings as well as avoid the necessity for regular replacements, you need to maintain good oral hygiene practices. It is important to brush your teeth at least twice per day as well as flossing frequently and going to your dentist regularly for routine dental cleanings and examinations. Avoiding habits which could damage the fillings, like chewing on objects that are hard or grinding your teeth or making use of your teeth to open packages. If you feel any discomfort or sensitivity within your fillings, make certain to speak with your dentist immediately in order to avoid further harm to the tooth. Dental fillings could require replacement due to various reasons like damage, wear and tear, or even damage. If you think that your filling in the dental cavity might require replacement, you should make appointments with your dental professional to have an in-depth examination and the appropriate treatment. If you take good treatment of your fillings as well as keeping a good dental hygiene regimen, will make sure that the fillings in your mouth will last for a long time to be. Make sure to talk with your dentist regarding what is the most effective method to replace the fillings in your mouth and answer any questions or concerns that you might have regarding your procedure.